overseas to do that kind of thing. He's a hero.
According to OrganDonor.gov, every 14 minutes a new name is added to the National Organ Transplant Waiting List, a list that just reached an historic number.
Right now, our national transplant waiting list just hit 100,000 people, so there's a huge need for organ donors in the United States. Whether or not we'll ever be able to fulfill that need, we don't know, but definitely we need people to register, we need people to sign up.
As drivers renew their licenses or are getting it for their first time, they have the option of making a big decision whether they realize it or not. It's not just a matter of getting behind the wheel, it's a decision that could eventually mean life or death for them or someone else. When going to the DMV and receiving our driver's license, there's a simple yes or no question. The question, do you wish to be an organ and tissue donor? Annie Wienes, driver examiner in Hastings, Nebraska, describes what checking yes entails.
What it means when you check organ donor is that if for some reason you're in an accident or you're having your body's not responding, it gives those that are attending you, either a police officer or a doctor, the opportunity to talk to you and or your family members, especially the family members if you are no longer to talk for yourself, that you have signified you want to be an organ donor.
Whether you're a donor or not, making the decision is important as fatal accidents occur every day. By voicing your choice to your loved ones, you can make sure that the decision that is made is the one that you want.
Unfortunately, when something traumatic arises, especially on a young patient, a lot of families, it's a very difficult process, and to come to grips to be able to donate your loved one's organs are very difficult. So a lot of donors are lost because their families don't know their loved one's wishes.
With more than 400 patients currently waiting for a transplant in Nebraska, a new national record exceeding 100,000, and the fact that 20 waiting patients die per day, it becomes clear that for many on this waiting list, it's a question of both if and when.
Because of so few donors, so many people die. And unfortunately, unless you've been touched by that personally, I don't think a lot of people think about it day to day. I don't think people are being mean and don't want to give their organs away. I think it's just kind of, an unforeseen unless you've dealt with it.
Waiting times are different for each organ. A patient can expect to wait anywhere from 3 months to 2 years, depending on their blood type, body size, and activation status.
But essentially how it works is your height, weight, blood type, and then antibody profile. And those are kind of the 4 indicators that get you matched with a recipient and donor.
Another variable that can affect the length of a patient's wait is a history of abusive behavior. Because the transplant process is so delicate and organs so few, patients with a history of smoking or alcoholism must face a penalty period of sorts for a minimum of 6 months. The patient must abstain from these damaging behaviors. During this period, recovery is the goal. It takes a healthy body to accept an organ transplant.
So since organs are limited, we really want to make sure that somebody that's going to get the organ is going to take care of it. So we look at all things like ability to make the behavioral changes that are necessary. So no drinking, no drugs, no tobacco, being able to change your diet, exercise, take all your medications.
Approximately 1/3 of patients in need of a transplant die waiting for their organ. Those who live through the wait, some up to 10 years, attribute their survival to hospital counseling, family support, and most of all, hope for the organ they so preciously need.
But everybody wants to know, how quick can I get back to work and get back my regular life? Well, your regular life is over. And you have to understand that. You have to understand that you have to figure out what you've been given. Sometimes the organs aren't quite as good as mine was an awesome match. Some are not. And you need to be flexible and work with what you get and reset your normal.
Most of the organs used in transplants come from people who have suffered brain death as the result of an accident, heart attack, or stroke. The donation of organs is acceptable only when the person is brain dead and on life support. Even though they are technically dead, their body is still functioning, which means the organs are remaining healthy.
A lot of these patients are kept alive so we can take the organs. And so a lot of families have a hard time, once they've accepted the death of their loved one, to be able to understand for the next 2 days or so, whatever time it takes, that we have to keep them alive to get organs.
There's a common misconception that if you are a donor, the doctors that are taking care of you will not take all necessary means to save your life. But the goal of any doctor is to save your life.
Donation is an end-of-life decision. Our organization actually isn't even contacted until you've been declared dead. So the chances of your doctor ever even knowing you're an organ donor before we're contacted are slim to none.
Once the pronouncement of death is made, the hospital by law must call the state organ recovery bank and see if the patient is an organ donor. If yes, the recovery team will be dispatched to the hospital and check all the organs and tissues and make sure that they are in good condition.
We're required to be notified by the hospital of every single death that occurs within their facility. Once we've been notified, we go up and do our evaluation to determine if the patient is even eligible to become an organ donor. If they are, we speak and work with the family members to make sure that they're okay with the donation. And then we're going to spend anywhere from 24 to 48 hours in the intensive care unit within the donation hospital, medically managing that donor, trying to turn any poor organ function and make the organs function better in order for transplant to happen, as well as planning logistically all of the things that surround transplant.
However, even if you are registered as a donor, it might not mean that all your organs will be donated. Automatically, anyone with cancer or diabetes are excluded. There is no age limit for donation, as transplants are done for all ages.
There are some very strict medical criteria that must be met, as well as some social history stuff that we look at for high-risk behaviors, because we don't want to transmit any disease whatsoever. We're beginning to be a little bit more lax with some of the medical criteria because the list is beginning to grow, a lot. And so with it being over 100,000, people that used to be ruled out for hepatitis because they had hepatitis are no longer ruled out because there's patients on the waiting list that have hepatitis. So we're not reintroducing a new disease to them. They already have that disease.
If the donor is eligible and there is a recipient match for the organ transplant, the recovery team takes the next big step and begin the process of recovering the organ.